Hello dear students, myself Dr. Maddineni Srinivas. Welcome back to my YouTube channel. So in this video we are going to look at the important theory question which is acne vulgaris, which was recently asked in various examinations. So you can see here acne vulgaris causes, risk factors, clinical features and management. All these are going to be covered, and after watching this video you should revise from these books. Any of these books I would advise, any of these books is going to be enough. Okay, so etiopathogenesis of the acne vulgaris. You should understand what is acne vulgaris. It is a chronic inflammatory disorder of the pilosebaceous unit. Remember students, sebaceous glands, they are going to open along the hair follicle. So if there is a damage or involvement of this pilosebaceous unit, we are going to see the patients are going to present with acne vulgaris. And pilo simply means follicles and sebaceous unit is sebaceous gland. So remember, this is also a possible MCQ which you can get in your examination. And there are four important factors which are going to play, out of which the first and foremost is increased sebum production. So sebum is produced from the sebaceous glands, and these sebaceous glands are present from the birth, but they are going to become active only during the puberty. During puberty, there is going to be overactivity of the sebaceous glands, so sebum is going to be secreted in more quantity. So the quantity of the sebum is going to correlate with the acne severity. So next step is follicular plugging. So just remember this picture whenever you get a chance to draw a diagram in the examination. My suggestion is 100% take that advantage of drawing this diagram, so that examiner will get to understand that this student is knowing the topic which he is writing, he or she is writing. Okay, so this is the picture which you can draw, very simple. So you draw a skin surface and you make a invagination of the skin, you make an invagination of the skin, and you can draw a small hair inside this hair. As you are able to see, this is the hair, and you can draw a gland which is pouring out the secretion, which is a sebaceous gland. You can see this invagination is called as a hair follicle. Okay, so in acne vulgaris what happens is there is going to be one bad thing happening, that is at this opening. Okay, so there is going to be a plug formed. This plug is made up of the keratin and the sebum. Okay, this plug is going to obstruct this sebaceous gland secretions to come out onto the skin surface. That is, sebum is going to be obstructed and it is going to be accumulating inside this pilosebaceous unit. So the next step is formation of this comedones. Okay, so remember, due to this obstruction, what happens is small black dots and white lesions will be seen on the skin surface. These are called as comedones. Very important MCQ you can expect related to acne vulgaris. In acne vulgaris, what are the hallmark lesions or what are the pathognomonic lesions which you can see? If this is a question which is asked, then you can answer it as comedones. And there are two types of comedones. You might have heard it in the layman terms. They are called as blackheads and whiteheads. So why are they called as blackheads and whiteheads? So they are actually called as open comedones and closed comedones respectively. So whenever this blockage is there, so this blockage which I am talking about, this blockage, if it is completely blocked without any possibility of the atmospheric oxygen to enter inside, then what happens? The lesion will appear white in color clinically. Okay, so that we call it as a whitehead, or it is also called as a closed comedone. Closed comedone. Whereas if there is any possibility for a small, air, if there is a possibility of the oxygen, atmospheric oxygen to gain entry into this unit, then what happens? There will be oxidation of this sebaceous material present inside this pilosebaceous unit, because of which the color of the lesion will become black. So that is the reason why these are called as blackheads. These are also called as open comedones. So very important points, whatever we have discussed till now, all these are very important if you can write them in the theory examination. So the next step is going to be the normal commensal, which is Propionibacterium acnes, or it is also called as, other name for this is Cutibacterium acnes. So this is the bacteria which is present in everyone, in you and in me. It is present in the sebaceous gland, but in the patients of acne vulgaris, because there is obstruction, follicular plugging, what happens is there is going to be hyperproliferation of this Cutibacterium acnes, which is going to produce the inflammatory mediators, most important of which is a free fatty acid. So all these are produced because the Cutibacterium acnes, it is going to eat on the sebum and it is going to produce this inflammatory mediators and free fatty acids. Next step is the inflammation. Okay, so when all these inflammatory free fatty acids are increasing and there is this bacterium which is hyperproliferating, then what happens is there is going to be inflammatory mediators produced, and all this is going to produce the retention of the contents inside this pilosebaceous unit and hair follicle, because of which there is going to be bulging of this pilosebaceous unit hair follicle, and ultimately it will yield and it will rupture, and all the contents are going to be present inside the skin itself. Okay, so the rupture of the comedone triggers more and more inflammatory responses and foreign body reactions, which will clinically appear as nodules and cysts. Okay, so in this picture you can clearly understand all these four important factors which are happening here. So the number one is the increased sebaceous gland secretions because of the activity of the androgens or testosterone, and the second one is the follicular plugging. So because of this, what will happen? There will be this bulging of this hair follicle or pilosebaceous unit which is happening, and inside this there is going to be Cutibacterium acnes which will eat on the sebum and produce the free fatty acids. Okay, so there will be free fatty acids which are going to be produced, and ultimately what happens? This is going to rupture. This is going to rupture and throwing out all the secretions, the sebum, keratin, and also the Cutibacterium acnes into the surrounding skin, because of which there will be marked inflammation and also scarring which will be seen. So there is going to be scarring, and also clinically we can see nodules and cystic lesions in these patients. Okay, so what are the factors which are going to modify the acne? So remember students, whenever the climate is hot and humid climate, that is going to aid in the development of the acne. And in the diet, remember, very high glycemic index diet is going to trigger the acne vulgaris. What are the foods which are high in the glycemic index? So all those foods which are going to elevate the blood glucose levels and produce a spike in the blood glucose levels immediately after eating. So most importantly, the sugar, all those white things, okay, sugar, and also the maida, the processed foods, and pizzas, burgers, the chocolates, the biscuits, the colas, okay, Pepsi, Coca-Cola, whatever, these all this stuff, they are having high glycemic index. All these are going to be associated or have a triggering factor in the acne vulgaris. Okay, and also remember students, it was observed in various studies that the milk and its milk products are also going to induce the IGF, insulin like growth factor, and they are also going to block the pilosebaceous ducts and produce the acne. And also there are certain facial cosmetics which are oil based, which can cause physical obstruction of this pilosebaceous unit, leading to the acne vulgaris. And there is certain genetic predisposition in certain individuals, and also hormonal factors. If you remember, if you are a female, you might be knowing this, before the menstruation there is a premenstrual breakout, small acne lesion will be developing. And also PCOS, polycystic ovarian syndrome, if you remember, Hyran syndrome, hyperandrogenism, insulin resistance, acanthosis nigricans. In these individuals, there is also possibility of association of acne vulgaris. And if you remember, acanthosis nigricans is also one very important question. If you want me to make a short video on this, please do comment acanthosis nigricans in the comment section. Okay, so now coming back to the clinical features of the acne vulgaris. So clinical features: comedones, as I have already told you, closed comedones and open comedones. Closed comedones, they are white colored lesions. They are in layman terms called as white heads, and there will not be any central opening, so it is a closed one. In the open comedones, there will be a small opening, because of which the debris, the sebum and keratin, will get oxidized, so that will appear as dark colored papules, which we call it as a blackhead. So remember, comedones are pathognomonic or hallmark lesions of acne. So next type of lesions are inflammatory lesions, which can range from the papules, the pustules and nodules. Okay, and the healing of these lesions is going to ultimately produce a scarring. So what are the common sites? Like I have already told you, face is the most common site, but it can also affect the shoulders, chest, and also the back. The trunk can be affected. And there are certain variants of acne which you can just remember. Acne fulminans, it is a severe form of the acne in which the patients are going to have, along with the acne lesions, fever, because of the excessive inflammation which is happening in the body. You can remember it as fulminans has any, and they are going to be associated with fever. So now there are 4 important grades of acne which you need to remember. Depending upon what are the predominant lesions which you are going to see in a given patient, we have 4 grades. Okay, in the grade 1 acne, the lesions which are predominantly present are comedones. So you are able to see here. So these are the black comedones. So black heads, and these are the white heads. If you are able to see, okay, open comedones and closed comedones. So the second grade, we are going to predominantly have the patients having erythematous papular lesions, and in the grade 3, the patients are going to have predominantly pustular lesions, and in the grade 4, remember, it is a most severe form of the acne vulgaris, in which the patients are going to have the nodules and cystic lesions. So you can see here, these are the erythematous papular lesions, and these are the pustular lesions which you are able to see, and these are the nodules and cysts. And if you want me to make a video on the primary, secondary and special skin lesions, please in the comment section write down skin lesions. Okay, I will make a video on this lesions also in a future. And where are these lesions present? Predominantly on the face, but also trunk can also be affected, and of course the chest. We have already seen this. So just I hope you are enjoying this video. If at all you are enjoying, as a Guru Dakshina, please just consider my request and hit that like button, so that I'm going to get that boost, or it is going to increase my morale to make more such videos on a regular basis. And also, to help your friends who are unknown of these videos, you can share this playlist. The playlist link I will leave it in the comment section, also description. Share this playlist so that they are going to watch all these videos, because of which there's going to be help for them also. So like, share, and also do subscribe, so that you're going to get these kind of awesome videos. And if you really like these videos, do comment thank you in the comment section, so that I will understand that you are really getting some value out of these videos. Next, coming to the management. So broadly, you can remember what is a management. Local measures can be done. So for mild to moderate acne, cleansing with soap and water. So these are routine things which you can advise. The precise management which you are going to advise the patients is going to be the topical keratolytic medications. Topical keratolytic medications, they are going to remove the follicular plugging which is obstructing this sebum and keratin. So what are those agents? Very important for you to remember: retinoic acid, the benzoyl peroxide, salicylic acid. So these are helpful in removing that plugging, because they are going to normalize the process of the keratinization in the skin. Next is, because this is associated with Cutibacterium acne, so antibacterial agents are also going to be used. And what are those? Azelaic acid, erythromycin, or clindamycin. Okay, these can be used. And if there is so much of inflammation happening in the lesions of the grade 4 acne, that is nodular cystic type of acne, we can also inject the steroids into the cyst, which we call it as intralesional steroidal treatment, ILS. In short, we call it as ILS. And the steroid which you are going to use is triamcinolone. And there are some cosmetic procedures, okay, surgical procedures also, like for example dermabrasion or excision of the scar. If the scar is formed, we can excise that scar. And systemic measures are also very important for you to remember. So we have antibiotics which are the tetracycline group, mainly the minocycline and doxycycline. These are used in many of the patients, and also apart from that, erythromycin and also trimethoprim sulfamethoxazole can also be used. Routinely we use this doxycycline, minocycline, and also we use in the patients azithromycin. And one very important treatment modality which you need to remember is isotretinoin, which is also called as 13-cis retinoic acid. This is the drug of choice for the grade 4 acne. You must remember, this is a oral medication, and it is highly effective in the severe cases, that is grade 4 acne. It reduces the sebum and also it reduces the comedones. But the problem is that it is having the teratogenicity. So it can produce the teratogenicity. So pregnancy should be avoided. And what is the duration of the drug-free period? We have to advise the patients after the stoppage of this medication is at least a period of 1 month to 3 months. Because isotretinoin can stay in the blood for a period of 1 month to 3 months. So we have to advise that the patients should not use the isotretinoin just before they plan for their conception. Okay, so there should be a period of at least 1 month, 3 months gap where they have to use contraception and they have to avoid any planning of the pregnancies. And also hormonal therapy can also be used in the form of estrogen, so oral contraceptives for women. Okay, so now briefly to say grade 1, grade 2, grade 3, grade 4. So what are the treatment modalities in all of the grade 1, 2 and 3? Remember students, the topical retinoids are going to be the common treatment which we are going to use, but in the grade 1 acne we are going to use only and only topical retinoid, which can be tretinoin or adapalene. As you are able to see, these are the topical tretinoin and adapalene which we are going to prescribe in the grade 1 acne, where mainly lesions are comedones. Now coming to the grade 2, in the grade 2 topical retinoids will be continued and topical antibiotics are going to be added. What are the topical antibiotics? You can remember they are clindamycin and nadifloxacin. Whereas in the grade 3 acne, we are going to use topical retinoid, along with that we are going to use oral antibiotic like I have told you, minocycline, azithromycin and doxycycline. How can I remember this? MAD, if you see clearly, they are starting with MAD, minocycline, azithromycin and doxycycline, MAD. And in the grade 4 acne, I have already told you the treatment is going to be oral retinoid, which is isotretinoin. And remember, benzoyl peroxide is a topical antibiotic which we use in the patients of acne vulgaris. And remember, topical steroids are not used in the acne management. Never do we use the topical steroid creams, ointments for the patients for the treatment of acne. Okay. So like I have told you, if you like this video, do hit that like button and do also share this playlist. I will leave the link in the comment section, also description. So this is in tomorrow's or next video. If I get at least 20 likes, I will consider to make a video on this particular topic. And if you know by reading this question what is the diagnosis, put your answer in the comment section. I will write down the diagnosis. It is psoriasis. Okay, I hope you enjoyed this video. Do read from these books. Okay, don't just leave by watching this video. You can join all my groups, Telegram, Instagram, and subscribe to my YouTube channel so that you are going to get all the future updates. And also, thank you so much for watching this video till this point. Happy learning, all the dear students. All the very best. And do also comment what do you think about my T-shirt. How is it? Is it cool? So comment in the comment section. Bye bye. Happy learning. If you are having any doubts, like I have told you, you can ask me in the comment section.